Hi Barmies, today I want to talk to you about the pill. So estrogen and progesterone combined. Estrogen, progesterone combined makes up the pill. How does it work? So you usually have a round package with 21 days of active pills and 7 days of inert pills. And it's really important that you go ahead and just tell your patients to keep taking the 7 days of inert pills because it keeps you in the habit. Because if you miss a day, you will have to use backup contraceptives. So we need to have our patients form a habit. So one of the things we can tell them is if you take the pill while you're doing something else that you do every day, like brushing your teeth or eating breakfast, you can it'll help you get into the habit because it's really important that you don't miss a day. If you miss a day, you can take 2 pills the next day and then continue with your regular pill schedule after that. If you miss 2 pills, you really need to use backup medication. If you miss 3 pills, you might as well just start over you just wait until you get your period and then start over. Okay, so how do we remember estrogen and progesterone and what do they do in our body? So estrogen, think egg, egg, estrogen, egg. So estrogen has a big spike in the middle of your cycle. So if you look closely, day 14, ovulation. That happens because of a spike in estrogen. After that, we will look at progesterone. So progesterone is the pro-pregnancy hormone. Progesterone gets your uterus ready for a pregnancy. So you have a buildup of tissue for the remainder of the cycle, a buildup of tissue based on progesterone, and then you have, if the egg is not fertilized, then you have a drop in progesterone and you get menstrual bleeding, menstruation. Okay, and then the cycle starts all over again. So if we want to prevent pregnancy, one of the ways we can do that is by giving a dose of progesterone alone, and that is Depo-Provera. It's given as a shot and it lasts for 3 months. So if you have a client who is unable to take a pill every day or just is not compliant with taking a pill, you can take, and is certain they do not want to be pregnant for 3 months, then they can use Depo-Provera or medroxyprogesterone. And that is given with an IM injection. You can look at that needle. That is a hefty needle. Okay, so most pills are combined estrogens. However, we do have Depo-Provera, which is an injection and it lasts for 3 months. So let's see. I think I have covered everything. How does the pill work? It stops ovulation. It thins the uterine lining and it thickens cervical mucus. The thickened cervical mucus serves as a barrier to sperm. So by combining low doses of ENP into the pill, we prevent the spikes of estrogen and the spikes of progesterone, and we prevent ovulation. So if you have no egg, you cannot fertilize it. If the egg is fertilized, you have a thin uterine lining, so it will not be supported. It will not be able to implant. And then you have a third method of hopefully preventing pregnancy with a thickened cervical mucus. All right, so there you have it. Your literal daily dose.